Hello everybody. Today we will be discussing a little about cervical cancer. So cervical cancer is a very important topic that all women in India especially should be aware of. This is because cervical cancer is the second most common cancer among women specifically in India and countries like India, right after breast cancer. So today let us discuss about what is cervix, what is cervical cancer, what causes cervical cancer, what could be the possible symptoms of cervical cancer, and how we can prevent and cure cervical cancer, and how we can detect cervical cancer at an early stage. So this is especially important because cervical cancer, though it is the second most common cancer, it has the big advantage that it is a cancer which can be prevented and also a cancer which can be detected and hence completely curable in an early stage. So coming to what is cervix. So I have kept a small structure of the female genital organs. So for those who might not be aware or who are not science students, let me give a brief on what these structures are. So this is the uterus, which is also colloquially called the womb. And these are the two fallopian tubes of what are generally known as the tubes, and these are the two ovaries. So generally in a cycle, one of these ovaries will release an egg which is picked up by the tube and transferred to the uterus. And if you are sexually active at the time when you ovulate, you might conceive. If you do not conceive, you are going to bleed out from the uterus. So it is the uterine lining which is shed out every month as menstrual blood. Now coming to the most important topic of the day, the cervix. So it is this part, as you can see, this lip-like organ here, the lower part of the uterus, which we call the cervix. So colloquially people might refer it as the neck of the womb or the mouth of the womb. And the organ adjoining to that is this vaginal canal, and then outside, of course, which is not visible here, what we can see outside is the skin covered portion which is called the vulva. So as you can see, these are the three areas. So that becomes a vulva, the vaginal canal and the cervix are the three organs of the female genital tract which come in contact with the male organ during sexual activity. And hence cancers in these three areas, that is cervical, vaginal and vulval cancers, are heavily linked to sexual activity. So during sexual activity, once a woman is sexually active, she is always liable to catch an infection by a virus called the HPV. So this is something that I want you to take away or remember for the rest of your life. That is the HPV. It is a virus which is called the human papilloma virus, which every woman, once she is sexually active, is liable to catch in these three areas of her genital tract. So for most women, it is like the common cold. It just comes and goes by itself. The body, if you just give it time, the body clears off it by itself. But some of these strains of the HPV virus are quite aggressive. They are not like the common cold. They are like the COVID virus. So they can stick around there, lie in these cells for years, and over a period of 10 to 20 years become cervical cancer. And during these 10 to 20 years, there are minute microscopic changes that keep happening in these cervical cells, which we refer to as pre-cancer. And this is the lacunae that gives us the opportunity to pick up women in these pre-cancer stages, wherein they are going to be completely asymptomatic, have absolutely no symptoms. And when the doctor is going to look at her cervix, the cervix is going to look completely normal to the naked eye, but the cells in her cervix can harbor the virus. And this can be done by a test called the PAP-SMEAR. So the PAP-SMEAR is a very simple test which hardly takes around 5 minutes. Not even 5 minutes, I think it would take hardly 20 to 30 seconds, wherein the lady lies down, an instrument is inserted into her vagina so that it is opened up, and we have a look at the cervix, and a brush is inserted and a brushing is taken, and it is smeared on the microscope and examined to see if the cells have any pre-cancer lesion. It can also be coupled up with testing for the high-risk strains of the same HPV virus. So this is recommended for all women once they are sexually active, at least 3 years after their first sexual activity, to be repeated every 3 to 5 years up to the age of 65 years. So this is mandatory for all sexually active women. And it's a very simple test, because again I stress here, because if you can detect the cancer in this pre-cancer stage, this can be completely curable by simple surgeries or simple, you don't even need a surgical procedure. It might be curable by applying ice or current to that area, and you can be completely cured without any major side effects. Unlike when a person presents with symptoms later on, and most of the time, so let us go to the symptoms of cervical cancer. So what are the symptoms that cervical cancer could present with? So as I have already mentioned, the uterus is the organ which has the lining and sheds out the menstrual blood every month. So cervix does not have a strong lining which is shed out every month, which means that if there is a problem in the cervix, there isn't going to be much of a bleeding. So the symptoms of cervical cancer could be as simple as some amount of vaginal discharge, which many women tend to ignore, thinking that that is a normal vaginal discharge. The pointers could be persistent foul smell, not responding to treatments that the doctor has given, blood mixing in this vaginal discharge, irrespective of which part of the cycle you are in. Another significant symptom that could be missed again is what we call the intermenstrual bleeding, which means the person bleeds in between their usual bleeding times. So again, this could also be seen normally. But however, this is a symptom that you should not ignore. If you do find that you have a bleeding or spotting which is not at a time that your usual cycles are, or in between your cycles, you should report to the doctor. Another significant symptom that they could have is something what we call the post-coital bleeding, which means a spotting or a bleeding, a mild bleeding immediately after your sexual activity. In advanced cases of cervical cancer, the symptoms could be worse. It could be a severe back pain, it could be a severe pain on one side of your abdomen, it could be some lumps you have noticed somewhere, it could even be breathing difficulties if the cancer has spread beyond. It could even present as a urinary tract infection or difficulty in passing urine or a renal failure. So these are some symptoms, but what is to be noted is that symptoms of cervical cancer usually come in more advanced stages of cervical cancer itself and not in the pre-cancer stage. And once patients present in cancer stage, many a times these are advanced stages which can sometimes not be curable, and even if they are curable, they need advanced procedures, extensive surgeries, or the addition of chemotherapy or radiotherapy. However, in the pre-cancer stage, the symptoms are almost nil, but at the same time, if detected in the pre-cancer stage, the cancer is completely curable. So that is why all women should meet the gynecologist for a PAP-SMEAR once in 3 to 5 years, up to the age of 65 years at least, from the moment they are sexually active. So having said about the PAP-SMEAR, let us move to how we can prevent the cervical cancer. So fortunately now we know that almost all cervical cancers, not entirely, there's a very small proportion of cervical cancers which are not related to HPV. But having said that, almost all of the cervical cancers are from infection by the HPV virus, which is sexually transmitted. And hence we have a window of opportunity there wherein we can provide vaccines to prevent these infections before people are sexually active. So herein comes the HPV vaccine. So now the public is a little bit more aware of the HPV vaccines, especially with Mrs. Sudha Murthy speaking about it in her maiden Rajya Sabha speech, as well as the mentions of the HPV vaccine coming in the budget by Nirmala Sitharaman. So some of us are aware of the HPV vaccine, but let me put in a few of the nuances of the HPV vaccine along. So the HPV vaccine can be given as early as 19 years of age up to the age of 26. So this is the best times when the vaccine is most effective. The most studied age groups are these, from 9 years of age to 26 years of age. If from the 9 to the 14 years, that is before the 15th birthday, then the kids need only 2 doses, 6 months apart. Once the child is past the 15th birthday, she or he needs 3 doses of the vaccine. And there are 3 available vaccines in India currently. We have our own Indian-made Serum Institute of India vaccine, which is the Cervavac, as well as there are 2 imported vaccines called Gardasil and Gardasil 9. So you can find further details of this if you visit our hospital, or you can find it anywhere on the internet. So the other important thing that I do want to mention is that people who have vaccinated their children are also under the wrong impression that the vaccine is only for the girl child. So though the vaccine came out initially for the girl child with the idea of preventing cervical cancer, because cervical cancer is such a big prevalent cancer, the vaccine is also recommended for boys. Now, why is the vaccine recommended for boys? Is that the HPV can cause cancer in any area which is sexually involved. So in today's world, sexual activity is not restricted to just vaginal sex. So it involves oral sex as well as anal sex. So HPV related cancers can occur in the female genital tract, sometimes in the male genital areas, and also oral cancers, throat cancers and anal cancers. In addition, it can also cause genital warts. So the HPV vaccine can prevent cancers in all these areas as well as genital warts, and hence it is currently recommended for both boys and girls, ideally between 9 to 26 years of age. And this is a one-time, as in there are strict doses, so it's 2 doses less than 15 years and 3 doses beyond 15 years. So there is currently no indication for a booster thereafter. So that is in short about what is cervical cancer and what are the ways to detect cervical cancer and how we can prevent cervical cancer, and in short about what could be the possible symptoms of cervical cancer. So let me also go to some of the myths which are associated with cervical cancer. So we know that a lot of people do know about the vaccine, but they're also afraid to administer the vaccine to their children or take it for themselves, because if they've heard a lot of things about the vaccine. So there are a lot of anti-vaccine data, information on the internet saying that the vaccine is associated with paralytic diseases, increasing the chances of cervical cancer, as well as it is associated with polycystic ovaries. As of now, there is currently no data-backed evidence for that. The vaccine has very mild side effects, namely mild fever or pain at the vaccination site. We always recommend that the person stay in the hospital for around half an hour after the vaccine has been administered to see if there are any allergic reactions. Similarly, people think that cervical cancer is also linked to the use of sanitary pads and cups. Currently, there is no evidence pointing to the use of cups or sanitary napkins linked directly to cervical cancer. However, recurrent infections and poor hygiene may be a contributing factor to the progression of cervical cancer. The third thing what people link is to whether condoms can prevent cervical. So some people do ask me whether condoms, if HPV is sexually transmitted, will using condoms just prevent cervical cancer rather than vaccinating or coming for PAP-SMEARs. So yes, condoms do to an extent reduce the occurrence of cervical cancer, but it does not completely prevent cervical cancer, because for the transmission of HPV, you do not really need a penetrative sexual act. It just needs an intimate skin-to-skin contact. So condoms can only prevent the ones that are associated with the penetration, but not those associated with the intimate skin-to-skin contact. So as we end today's session, I would just like to remind everybody that cervical cancer is the second most common cancer among women in India. It is very much preventable by HPV vaccines for your children. And older women, the ones who are sexually active, we strongly recommend you to go for your routine PAP smears every 3 to 5 years, at least up to the age of 65 years.